Welcome to week 6. Last week we were covering a lot in terms of activating the core musculature, getting the transverse abdominis facilitated in several different contexts. We had hit that plank, we had done some of those 90-degree angles, 45-degree angles, pushing it to opposite spectrums. So last week was highly dependent on the core, and it's really important that you guys follow that program, that you brace down the core before we begin to activate the T-spine. Now this is not to say that this program is going to only be specific, that it's going to work for everybody, that this is the exact sequence in which it needs to happen. Some people tend to have a very strong kyphosis, and no matter how much they try and activate their core, their T-spine always tends to be the one that activates because that's the weakest point at this given moment in their exercise progress. So with that said, if you're a person that tends to feel more of their thoracic extensors, you may want to do this week more so than you did the last week. But even beyond that, you may already begin to feel your T-spine while you do the planks correctly, or if you do them correctly. But I mean, week 5 and 6 can typically be interchangeable, so it's kind of hard to sequence those two. But I really want you guys to make sure that you do emphasize those planks. Most of you are going to need that. Most of you are going to need to know how to brace your abdomen, how to activate your core before you start moving on into these next techniques. Now, what we're going to be emphasizing today will be thoracic spine function, how to get the thoracic spine to activate better. And the way we're going to be approaching this is through the usage of a prone cobra, and then another exercise that we call a wall retraction. We're then going to turn that into an overhead retraction and depression through the scapula, and that's going to help us integrate the thoracic spine with the scapular region, the thoracoscapular region. And then after that, we're going to start going into a few actual stretches that we're going to take your body through. We're going to take your body through some stretches that are going to help enable us to get a better thoracic extension. Those stretches are going to be a stretch of your quadriceps and a stretch of your rectus abdominis because those are going to be the tissues that are going to pull us down. Once we get done doing that, we're going to end off with some breathing in terms of understanding how to sequence your breathing through your abdomen and then also sequencing your breathing into your thoracic cavity. And we're going to do that primarily when we're applying it into a standing neutral position. Again, this is another section that's just, again, we're just laying down another anchor. The thoracic spine is another anchor that we need to have at given points during movement, and understanding these tensions will be fundamental if you expect to be able to progress through this system and eventually move on into the movements and improving your gait cycle and things of that nature. So what we're going to try and emphasize right now is going to attack a prone cobra. Again, the prone cobra is going to be a really good thoracic extension building exercise. The problem is that the way that most people do a prone cobra is not necessarily very advantageous. Most of the time when people do their prone cobra, they go straight into hyperextension, and not that the hyperextension is necessarily that much of a bad thing, but again, when you operate solely from a hyperextension and it's a fixated hyperextension, that's when we're going to have that problem. So if you're just doing this kind of stuff and you're just bending into your lumbar and that's all you do, not going to be a good thing. So what we're going to try and do is almost flatten the T-spine and try and get that activity through this prone cobra exercise. Some things to consider with it is if you don't understand how to activate your lower abdominal tissues, we're going to have some severe problems trying to get this queued up, and you guys are going to see that right now. So what I'm going to have Kathy doing right now is I'm going to have her laying down face down here, and what I want to have her do with her hands, she's going to just bring her hands to the floor right here and right here, okay? She's going to be laying down in this fashion, and I'm going to have her push her knees into the floor. You're going to drive your knees into the floor ever so slightly, Kathy, and you're going to keep your toes down. And by her driving her knees into the floor, it's going to enable her to elevate her hips off the ground a little bit further from where she's at this given point, okay? She's already pretty much operating from a neutral spine. She already has very good thoracic extension. We're going to try and emphasize this a little bit, but for most of you, as soon as you just lift your pelvis and you give me a posterior pelvic tilt, and you give me 1 millimeter of elevation of your upper body, keep the chin down, Kathy, and then just elevate the upper body. And then from there, I need you to retract your upper abdominals a bit. There we go. As long as you just lift that up and you retract your abdomen with the posterior tilt, and you lift this up a slight bit, can you feel this working here? Yes or no? You'll already begin to feel a substantial tension. Take a break. You may only need to do that for about 2 to 3 seconds. Because it will feel very, very intense. So really all we're doing to start this exercise off, we're just thinking about driving the knees to the floor a little bit. That's going to enable us to lift the pelvis. Again, that's taking us out of the hyperextended state. Let's take them into the actual hyperextended version, Kathy. Go ahead and keep your hips completely on the ground. Lift your chest up as high as you can. and then bring your arms back. This is a traditional prone cobra, the way that people typically end up doing it. This is where you're end up getting that tension there. So we're trying to eliminate this process from happening in her body. This area tends to already be hypertonic in most people, and they already have this this over-engagement of these tissues in these areas already. So we're trying to eliminate that. So she's going to drop her chest down. So what we're doing, because she's already in a hyperextension. When you lay down face down, you're essentially going to be in a hyperextension no matter what. So we have to get out of that hip hyperextension. She's got to lift her pelvis up here. There we go. Then she's going to rotate the pelvis posteriorly a little bit. So now she's out of the lumbopelvic hyperextension, and now it's going to enable us to then do the work right here in the thoracic spine. Okay, so I want you guys to think that these are dependent structures, that if the lumbar spine does, give me a little anterior tilt here, Kathy, then retract the abdominals, then give me a posterior pelvic tilt. So if we have this this lumbar spine curvature right here, if there's nothing beneath this area right here and it's not stacked, it's going to be very difficult for these muscles in the T-spine to really facilitate that activation. Go ahead and retract the shoulder blades now, Kathy. There we go. Keep that chin down. Right now you're seeing one of the remnants of her deficiencies right now is that she tends to hyperextend her cervical spine. So I want you to draw the chin down a little bit more, Kathy. Now we're in a neutral cervical, and now we're going to begin to get that activation even in the rhomboids. Take a break. It's actually a very, very brutal exercise. There's not much going on here, and it's all in the details. I want you guys to also consider that posterior tilt always needs to come with that gentle retraction of your abdominal wall. I remember we remember that we covered that in week 4. Week 5, excuse me, the week 5 exercise, we had covered that before in terms of how to recruit your TVA, how to recruit those abdominal fibers to facilitate a TVA activation. So the key point is if we want to get a really deep contraction in the T-spine, we need to find a deep contraction in the core, a deep contraction in the TVA. And so when we do that posterior tilt, we want to emphasize that retraction of the entire abdominal wall to ensure that we're getting that deep core engaged. So we're going to lift the hips up again, driving the knees into the floor to get the hips up. Then she's going to retract the entire abdomen, so I'm able to slide my hand underneath, retract this here a little more, Kathy. There we go. Now we're going to just retract the shoulder blades a little bit. Beautiful. Going great here. So you guys will see a nice flat spine here, okay? I want you to now breathe into your rib cage a little bit, and we're going to start slowly pushing those spectrums as we move along through this program. We're going to be really trying to get that thoracic, maybe that thoracic engaged with some intra-abdominal pressure, and that breathing is going to be fundamental in that process. Go ahead and take a break. So that's going to be a prone cobra. Just think the main areas of tension that you're going to need to feel active will be these thoracic spine muscles. We're going to be looking at a segment from right here to here. If you're not feeling a burning sensation happening in these areas, it means that you're doing it incorrectly. It's a very simple exercise. The spine is flat. We lift the hips, lift the hips, lift the hips, retract the abdominals, retract the shoulder blades ever so slightly. Good. Retract the upper abdominals now. Now you guys are starting to see a little bit of a bend right here in this T-spine. She needs to retract the upper spectrum of the abdominals. It's almost like she's pulling her xiphoid process to the ceiling, that little bone. She's going to pull it to the ceiling as she does a posterior tilt. Good. And she's doing really well with the cervical hyperextension. You can drop the hands from where you're at. And we're just thinking about the T-spine alone, okay? Give me a posterior tilt, retracting the abdomen, and take a break. Okay, now a typical problem that's also going to happen is that as soon as she does that posterior pelvic tilt, she's going to go into a kyphosis. Remember that when we tilt the pelvis under, most of the time the upper body's going to want to create this kyphotic pattern because we typically have these restrictions right here on this upper set of abdominals. So as she tucks under, it's going to be more prone that her upper body's going to want to stay on the floor. All you have to do is just fight that inclination by just pulling your upper body up as you do this tuck together. Remember, these things all have to be sequenced simultaneously. If you tell a person or yourself to do a posterior pelvic tilt and then by itself do the extension of the spine, Kathy might drop her pelvis to the floor and then go lift the chest. She might then go into this problem again. So we always want to look for the spine getting remotely flat here. Okay, so we're going to lift the hips up. At the same time, we do the posterior pelvic tilt and we lift the T-spine simultaneously as we retract the abdominals. This always comes along for the ride. She's going to do the breathing again into the rib cage, and we'll be working on that a little bit more later on in this video. Okay, go ahead and take a break. Okay, so this is a huge posture builder. It's a pretty basic exercise. I typically like starting off with this exercise mainly because it's just that harsh. We want these types of corrective exercises to be strenuous. We want there to be a stress association involved with the body here. Remember, stress got you into this mess of dysfunctions. Stress is going to get you out of this mess of dysfunction. So she's not feeling a substantial amount of strain right here, a substantial amount of stress right here. We're not going to grow very much here. We're going to do this one more time, and we're going to move on to the next corrective exercise after that. So we're going to lift up the hips. We're right there at that posterior pelvic tilt. Beautiful. Okay, I want you to breathe into right here, Kathy. There we go. Retract the upper abdominals. Okay, the cervical spine is going to be nice and neutral. And we're good. Pretty basic stuff, guys. Nothing too complicated if we know what details we're supposed to be looking at. After years and years and years of looking at the feet, the knees, the hips, the lumbar spine, the thoracic spine, the cervical, it's been a process of finding out what the right cues are. And it's really just that posterior tilt and the extension of the T-spine with that retraction of the navel. That's going to get you a lot of that T-spine function. Now, one more thing that I'm going to remind you of is to be very careful with that cervical hyperextension. You can create a lot more problems and exacerbate a lot of the cervical hyperextension if the neck keeps coming up like this when you try extending. So make sure that chin is nice and tucked while you're doing this to ensure that we don't end up creating any more of that exacerbated cervical hyperextension. This is a very common problem that happens with the prone cobra, and I don't want you guys to succumb to those problems when you do this exercise. Okay, so now we're going to go to our feet. We're going to be hitting the wall over here, and we're going to start doing another exercise called wall retraction. So let's go ahead and come to our feet, Kathy. Okay. So now we're going to exercise once again the thoracic spine, and we're going to have her, Kathy, bringing her back to the wall here. All we're going to try and do is create a flat back posture, and the associations that become very challenging for people to make. The prone cobra is primarily a thoracic spine, a thoracic extensor exercise. This is going to be the unifier primarily of the scapular region with the thoracic region. Okay, that's what this exercise is made to do. Go actually give them a lateral view here, Kathy. Oftentimes when people, not oftentimes, almost every time somebody retracts their shoulder blades, Kathy, and go into a thoracic hyperextension. This is typically what people do when they retract their scapulas. Most people have been duped into this thinking that this is a good posture. When you pin your shoulder blades back and you're doing this, that's a good posture. And so they don't realize that when you just change one structure, your body's going to compensate around that structure because it didn't learn how to be efficient and make adjustments in other parts of the body. So when you learn how to retract your shoulder blades, but you never learn how to posteriorly tilt your pelvis or posteriorly shift your pelvis, odds are you're going to go into this dysfunctional position, right? Where you're hyperextending the thoracic spine. And this is likely going to be the case with many of you. Right now what this exercise is going to be is for us to eliminate that potential thoracic hyperextension. Now, what are the implications of this? Typically, it's that when you start going into a dynamic setting, dynamic movement, if you start doing cable presses or if you start running, for instance, there's a very, very fine balance between your pectoralis major and your latissimus dorsi. Okay, so if I'm running here and my arms are reciprocating one another in this fashion, if I over-retract my scapula in this fashion, I'm losing tension in my pectoralis major right here, and then my shoulder is just going to come outward. So with a lot of women, they tend to lose their structure, they tend to lose their tensegrity, and their arms begin to flare out this way because women in general tend to over-retract their scapulas. Males in general tend to overwork their pec muscles, and where do they end up? Running across with their arms like this. And what is this primarily a result of? That there's no tensional balance in the thoracic spine to help facilitate a balance between the pec major and the latissimus dorsi. So if I'm running functionally, my arms are going to be pumping in the sagittal plane for the most part like this. And in order for me to do that, I can't over-retract my scapulas. And that's what we're going to emphasize here is this proper retraction of the scapulas with a neutral thoracic spine. We need to draw these associations together if we expect to have better application when you're performing things like gait or going into any dynamic movement in general. This is involved in throwing. We need to learn how to find that neutral T-spine. Okay, so by cueing the thoracic extension or hyperextension with the retraction, we're breeding all sorts of problems right here in the pec major, and this is a very important muscle to have well engaged. This is a very functional muscle, and we need to have good activity in it. So we're going to be going here, and I'm going to have Kathy just flattening her spine to the wall in this regard. So if I'm going to measure whether somebody's engaging here correctly or if they're not, I'm just going to try and fit my hand through the swell of her back. And right now, from where she's at, I can't fit my hand anywhere. It should fit through the cervical spine, however. Like right around here is going to be fine. As long as the cranium is on the wall, there'll be space right here at the C-spine. Okay, so I was going to track my positioning here. Now, most people, when they're in this position, what they're going to do, they're going to either hyperextend in this area where there's going to be a space as soon as they get here. It's going to be up to them to push their rib cage posteriorly to the wall, right? If you tell them to push their rib cage posteriorly to the wall, you're going to notice that their shoulders begin to round forward, and then you're really going to see one of the biggest problems here. Let's give them a lateral view from this side. Then you're going to see a humeral hyperextension here, which is a very, very prominent issue with people as well. Whenever they stand or they walk or they run, they're always operating out of this hyperextension and this anterior tilt in the humerus. Typically, the forward head comes along for the right on that, and this is the tensions, the problems that we're typically going to find. So when you flatten the spine, we want to flatten the spine to the wall and take away those dysfunctions that she's doing right now. So let's go back into the kyphosis, Kathy. And then we're going to go humeral hyperextension. So first thing we want to do is flatten the spine to the wall. We're going to probably get a little bit of kyphosis that comes along for the ride. So she may have to do a little posterior pelvic tilt in order to flatten the lumbar spine to the wall. Then she may have to lift her breastbone to get a little bit more flattening to the T-spine. May have to pull the rib cage back in this area here to push all these areas back. Now, you guys see that this hyperextension is prominent here. She's going to get a crazy amount of tension in her upper trapezius. A lot of pressure on the AC joints happening right now, and the pec minor is going to engage like crazy because it's in a shortened, contracted state, and that's going to cause all kinds of rotator cuff impingement. So it's going to be essential that I pull the hands forward here. I'm going to move them slightly ahead of the body. Now what I'm going to tell her to do is to shift her humerus back to the wall without moving the elbows. Pay close attention to that. If the elbows come along for the ride, that's pec minor wanting to activate once again to stabilize the shoulder. Most of you are going to be pec minor stabilizers through here, through the muscles on the front side. You're going to be scalene stabilizers, upper trapezius stabilizers, and these are going to be the points that are going to give the most tension in terms of stabilizing your neck and your shoulders. What we're switching that to, what we're going to transfer that to, is a stabilization going through the thoracic spine, the rhomboids, the mid-trapezius. We're trying to shift that responsibility to places that are going to be more practical. So again, the elbows have to come forward, and after the elbows come forward, she's then going to go into her scapular retraction. This is when we're going to begin to notice that this thoracic hyperextension is going to begin to pop up. So go ahead and retract, and now we begin to see this gap. Not sure if you guys can see that or not, but you'll see that my hand is going to squeeze through. This is what you're going to do whenever you adjust all these things. And again, it's just like that alcoholic who's trying to compensate by sweating profusely if they're having withdrawal symptoms, or by getting anxious, by feeling like they need to run somewhere to get the alcohol. Your body has compensation patterns. It compensates just like any animal, like anything else. The body does not want to change. It is up to you to see these variables. So one of the variables is going to be this. As soon as she retracts her shoulder blades, she may have the thoracic spine flat there, but then she wants to go, oh, we're going to go hyperextension. We eliminate that compensation. She then retracts her shoulder blades. She wants to go into a thoracic hyperextension. I then tell her, draw your breastbone back to the wall as you maintain that scapular retraction. And then you retract the humerus back a little bit further, pull the abdominals in, open the rib cage, expand the rib cage, retract the shoulder blades a bit more. And as she eliminates all those dysfunctions from her body and she begins to adjust out of those dysfunctions, you're then going to notice that she's going to probably begin to feel some activation in the thoracic spine. So there should be some engagement in the T-spine going on right now, and that's going to be the corrective exercise. Go ahead and take a break. I know it does not seem like much, but there's a lot going on right now in the body in regards to the way that we're changing positions. Typically, most people, if they go into a wall, they'll have this crazy hyperextension of their lumbar spine from where they're at. They'll just be here. Hyperextending, this is typically what they'll do if they're in a lordosis. Most people operate from some kind of a lordosis. Some operate from a lumbar flexion, but typically most are going to do this. So all we're doing is we're just taking away these compensations. If you look at my posture here, it's pretty jacked up, right? But if you notice, if I pull myself out of this dysfunctional posture, you're going to have to ask yourself, did you really do that much? And as I go here, did I make that much of a drastic change? The answer is no. You guys are about this far off from correcting your deficiencies. And when you start thinking about adjusting your structure and adjusting your biomechanics, changing the relation of your spinal structural integrity, that is going to have that's going to require minimal engagements and minimal adjustments of certain specific points. And that's what I want you guys to really start considering here, is that you're not making huge adjustments, it's just small millimetric adjustments, and that's what's going to create these changes in your body. So with Kathy, I'm going to have her coming right back to the wall here. Okay, so we're going to flatten the spine to the wall. If she's in a lumbar hyperextension, we're going to flatten that by having her do a posterior pelvic tilt. That flattens her to spine to the wall. The abdominals are going to come in. The breastbone is going to come up. She's then going to retract her shoulder blades from where she's at. Lift the breastbone up. Okay, the elbows are going to stay intact. Cranium's going to stay in place where it's at. Okay, and right now she's engaging the TVA. Breastbone's lifted, and she should be feeling, as this extreme scapular retraction comes back, a good thoracic extension, a good thoracic activation. Let's go right back to that lateral view, because there's another thing I want to make sure that you guys end up seeing. Look at the humeral positioning here. This is where most of you are going to be. You'll see how that humerus, even as you go here, the humerus may be there. Retract your shoulder blade, but don't move the humerus. Retract the shoulder blade. I'm kind of telling her to do something that she's not supposed to do, but this is what many of you are going to do. I'm telling her to retract her shoulder blade and retract her humerus. This needs to come back. Okay? If this comes forward, come forward, bring it forward. Let's move a little bit right here to the front side. You will see right here this clavicle, this kind of like this indentation going on here. That right there is going to lead to a lot of pressure happening in the AC joint and in the rotator cuff overall. This cannot happen. We do not want this thing indented. We want that to hide. We want the pec major to be eccentrically potentiated here from that clavicular region. So the pec major comes right here off the clavicle into the humerus. You need that to be eccentrically potentiated. After that, you can focus, fight my hand. You can focus on certain muscle activations to engage that part of the pec major. We're not quite there yet in terms of this programming. So pec major activation is a fairly complicated thing. That's why I'm not going to really cover it too much in the system. But if you get to here, this is really going to open the doorway to a whole lot of benefit in many other facets. So we're going to be looking at, again, the same hyperextensions beginning to pop up right here with Kathy. She's going to end up getting that anterior humeral shift in this regard. First things first, again, we move those elbows forward. I'm going to have her retracting her abdomen. I'm going to have her lift her rib cage up to the ceiling, kind of like we were doing with the standing neutral position. Then have her retract her humerus back towards that wall, and we're going to just flatten that spine to the wall. She's going to maintain that neutral spine, the neutral thoracic extension from where she's at, retracting the shoulder blades, retracting the abdominals. And in this regard, now she's going to begin to get that structural integrity that we're looking for with the body. One more thing I want you guys to really look at, to ensure that you guys are not going to be screwing up with, is this elevation or this forced depression of your scapula. This is something that people do all the time with their rows. I used to cue people on these things all the time, but do not depress your scapulas. If anything, I'm more concerned with you guys elevating your scapulas. It's important to note that people do not have strong upper trapezius muscles. They have very weak upper trapezius muscles from hunching and rounding their back in this fashion. The upper trap muscles right now are in a lengthened position. So therefore, if I'm like this all day long, with my thoracic kyphosis, there is no tonicity happening in my upper traps. I actually need to potentiate those things. That does not mean if she elevates her scapulas that her upper traps are going to remain hard. Relax. Elevate them slightly, functional. There we go. As she does that, her upper traps are actually very soft. They're very malleable. So right now, it's not even the upper traps that are really doing the work in terms of elevating the scapula. We're looking at more of the levator scapula, pulling the scapula superiorly in this regard. Okay? So we're looking at a deep scapular elevation that's going to then facilitate this nice square straight line in her upper body. Don't depress the scapula. I'll remind you guys again to not do that. Okay? You also want to look for the backside of the bone, that your scapular bones are not poking at the wall. It's kind of hard to be able to see that on the camera. This is something that's a little more specific. But if I slide my hand back here and I feel that her scapular bone is shooting back, activate your pec major there, Kathy, and then protract your shoulder. Yeah, she doesn't really do that much because she has really good scapular control, but oftentimes you'll feel the bone beginning to poke back here. Sometimes you got to just think about your scapula also flattening to the wall while you're in this position. Go ahead and retract the abdominals, elevate the ribs, keep the shoulders as they are, depress the scapulas a little bit now right there. So we're just looking for a nice straight line right here. Okay, so the clavicle should be for the most part in line right here with this AC joint or with the humerus itself. Okay. So now what we're going to do is move on into the next technique, which is going to involve us stretching the rectus abdominis. So Kathy, I want you to be laying down, face down for me on the ground. Our intent with this exercise is going to be to actively engage the thoracic spine musculature to stretch the rectus abdominis. But not just stretch the rectus abdominis that's going to antagonize the lumbar hyperextensors. We're going to stretch the rectus abdominis muscles that are going to antagonize the thoracic hyperextensors and force you into this kyphosis and keep you into this kyphosis. So we're trying to eliminate this condition within your body, so we have to stretch out the tissues right here specific in this area. So there's a few things that we have to look at when we're going to cue this. So Kathy, I want you to put your hands at your side, and I want you to just push your chest up as high as you can. Far as you can, keep going, keep going, keep going, keep going. So you'll see she's bending her spine right now, but if you actually look at what's actually bending here, it's mostly her lumbar. The lowest segment of her lumbar spine is where she's getting the stretch. So oftentimes when you see people who do yoga, they tend to miss that variable. This needs to anteriorly shift a little bit more, Kathy, from where it's at, but even then she's going to have problems doing that. So what she's going to do is actually push herself up a whole lot less than what she's doing right now. So I'm going to have you drop in your chest again, Kathy. We're going to then again elevate the hips a little bit. Stop there. Now you're going to push your chest up, and I want you to breathe into your thoracic spine from where you're at as you push yourself up. Keep going. Keep going, keep going, keep pushing, keep pushing, keep pushing, keep pushing, keep pushing. So now she's getting a little hyperextension here. Do you feel activation here? Keep pushing up a little harder. Breathe in, breathe in, breathe into your rib cage. And as she does that, she's starting to get a smaller continuous bend going on because we don't need that much hyperextension of the lumbar spine. Keep pushing up. Keep going, keep going, keep going, keep going. So now she's incorporating an active component in the thoracic spine while she's stretching her rectus abdominis. Take a break. And you may not feel that much of a hard stretch out of your rectus abdominis here, but that's not the only goal here. The goal is that we're developing an association to bend the spine the opposite way just a slight bit, so that way we can fall into more of a neutral spine. So I just want you guys to think that we're thinking about spectrums here. We have one end of the spectrum, the opposite end of the spectrum, and then we have the center. You are probably in the dysfunctional end of the spectrum on this side, so you're probably in some kind of a kyphosis here. So that's one end of the spectrum when you need to get to neutral. However, if you just shoot to neutral, you may end up back to a slight kyphosis. What we're trying to do here is push you a little bit to the opposite end of the extreme, into a little bit of thoracic hyperextension, so then hopefully you begin to fall forward into the more neutral point that we're looking for. So we incorporated activation to get you to neutral. Now we're going to incorporate activation and a little bit of stretch to get you past to the opposite direction. So we want to get a little bit of thoracic hyperextension. We want to get a little bit of lumbar hyperextension, but it has to be sequenced correctly. It can't all just happen in the lumbar spine as it does with the majority of all people in our culture. Okay, so we're going to try that again. I'm going to have Kathy lifting her hips up slightly, a little posterior pelvic tilt to prevent the lumbar from hyperextending too much. She's then going to push her body up from where she's at, maintaining the retraction of her scapula here. She's got very good alignment here. She's going to keep pressing up. Now she should begin to feel a little bit of stretch right there in that abdominal region. Do you feel that at all? Yes or no? Okay, good. And now she should also feel some engagement right here of these thoracic spine extensors. And now she's getting this hyperextension going on here, which we are looking for, but we're looking at a good segmented. There's actually a fairly good continuous curve happening right here in that entire spine. Go ahead and take a break. And again, really use that push from the floor to help you passively assist these thoracic extensors to get you up into range of motion. We're going to go one more time. Now I really want Kathy to sequence it with her breath. So you're going to breathe in super slow, and you're going to start pushing yourself up as you hold a little bit of that posterior tilt and you push yourself up. Keep going, retracting the shoulder blades a slight bit. Beautiful. Breathing into the rib cage too, guys. Retracting the abdomen a slight bit. There we go. We're pushing that nice continuous curve through the thoracic. Beautiful. So it's a very, again, the subtleties involved in this are again, the things are very minimal, but we have to look at those little details. We want a continuous curve. We don't want straight and then a curve. We want a whole curve happening through the entire spine. Keep hitting a few repetitions, Kathy. Excellent job. Very important to segment the breathing into it because the diaphragm does in fact engage at about this point as well. It doesn't just activate on the ribs, there's actually attachment points right here in that T-spine region. All right, so we covered the thoracic extensors. That's part of that front line. Go ahead and stand up, Kathy. That's part of that front line of tissue that pulls you downward. Now the quadriceps from the knee joint can actually pull your rib cage downward as well. So the quadriceps, in fact, can be an inhibitor of your thoracic extension. So if there's a line of tension that comes from the knees all the way to your rib cage, you can know that there's going to be some kind of a pull that gets you into this kyphosis here. So we're going to try and release the quadriceps as well. So I'm going to have Kathy putting one knee down on the floor and then putting her foot on the wall. So let's go, there we go. And I don't want you guys to bring your back foot too far back. We don't want to push the knee in too much of a deep knee flexion. That can be a little bit damaging to the joints. I want Kathy to be primarily dominant right here on her lead leg from where she's at. Okay, so we're going to hold this neutral spine right here. We're going to apply it in another conscious. Let's go ahead and get a lateral view from that side, about a 45-degree angle view over there. Okay, I'm going to have Kathy now beginning to institute a heel drag with the right leg. As she does that, she's going to anteriorly shift her pelvis as she keeps pulling that heel back, okay? Once she does that, she's going to posteriorly tilt the pelvis and begin to go into a slight lean back, almost like where she's going to go into an extension. And she should begin to feel a stretch right there on that left quadricep. Beautiful. What I want her to do is we're going to continue that curve, right? Going all the way from down in the knee, she's going to anteriorly shift the pelvis a little further and then lift her breastbone just a slight bit. Do you feel that stretch on your left quad? So now this is going to begin to move forward slightly in this fashion. And she's going to start getting this entire huge stretch from the quadricep all the way right here to the rectus abdominis, because there is a line of tension that comes down from this knee all the way to that rectus abdominis. And that's going to have a huge impact on her thoracic extension, believe it or not. Let's switch to the other side, Kathy. Let's go ahead and put your foot higher on the wall. Higher, a little bit higher, right there. So we don't need to push that knee flexion too far. We're relying more, we're stretching the rectus femoris on that hip flexor function. We're trying to eliminate some of that hip flexor restriction. But again, because there is a line of tension that's coming from the knee all the way to the rib cage, we have to make sure that we address this here, okay? So she's going to retract her abdomen here. Good. She's going to lean forward a little bit first. So I want you guys to lean forward. We're going to make sure that we're nice and neutral here. The knee, the hip, and the joint. I want you to be a little bit in a posterior pelvic tilt, slight hip flexion. She's going to bear down on her core just like if we were doing the standing neutral position. She's going to elevate her rib cage. She's going to drag the front heel back to incorporate a little bit of hamstring and gluteal tension. Then she's going to slowly begin to shift her pelvis anteriorly. Keep going, keep going. She can lift her breastbone up to the ceiling. Can you feel some activity here? Yes or no? There we go. We're going to create some activity in the T-spine. She's going to anteriorly shift her pelvis. And now she should begin to feel a stretch right there on that anterior portion of that quadricep. Go ahead and hit another repetition. Let's do the other side, Kathy. Very good. Okay, so we're just looking at that heel drag on the front side. Put a little more weight on your right leg, Kathy. There we go. So we're going to be nice and heavy on the lead leg, not so much on the back knee, putting most of your weight distribution there. We want to be careful as well on the anterior side that she's not shifting laterally too far that way. That will then only facilitate a certain type of tension on the IT band. She needs to shift her pelvis off to the left a little bit more. That'll take it off of the IT band and it'll place it more so on the core. It's going to put it more on the psoas and she's going to get more of a stretch right there in that rectus femoris. So we're looking for those alignments in those given points. So she's dragging off that right heel, posteriorly tilting the pelvis to make sure that she's not dipping into that hyperextension once again. And we're looking up for that continuous curvature in the spine. A nice expansion happening in the rib cage. And we're just pushing those spectrums. Let's slowly stand up, Kathy. And at this point, this should enable a person to have a little bit more of an upright posture. If you do that, it should feel easier to shift your pelvis back. It should feel easier to actually lift your rib cage if you follow those two stretches in the sequence. Now I'm going to have Kathy laying down face up. Keep in mind that I want you guys following this in order as well. Follow this in order, hit all the stretches, the abdominal stretches, the quadricep stretches. Follow all this in order. I want you guys to be rigid and regimented to this program. So you guys can do about maybe 3-4 sets of every one of these exercises. Stretch your quadriceps. Maybe when you do the stretches, you only need to do about 2 sets. When you do the muscle activations, you should do about at least 4 sets, maybe 5 sets of each one of the exercises when you do practice these techniques, okay? So what I'm going to have Kathy doing now, I'm going to have her bending her knees. Good. And what I want her doing is just starting to breathe into her abdomen from where she's at. Now go ahead and exhale, inhale. Go ahead and hang out here for a second. I'm going to institute a little bit of a feedback system right here for Kathy. And she's going to start breathing against the wall. Go ahead and hold that there, Kathy. And I want you guys, if anything, before we even do this, go ahead and put your hands on your abdomen from where you're at. And I want you to feel where you feel I want you to feel where the abdomen begins to elevate to the ceiling. If you feel it more on the upper ends of the spectrum, the lower ends of the spectrum, you're going to figure this out on your body as you lay down. What area tends to want to come up more? The area that tends to want to come up more is probably not the area that you need to release. I want my entire abdomen to be able to project forward. You guys will see how I'm projecting my abdomen completely forward here. It's because my abdominals are fairly well balanced. But most of you are going to probably end up having a lower abdomen projection. Some of you will have an upper abdomen projection. What I want you to do is feel what area projects, and then you're going to take this ball and place it on the area that's not being projected. I can notice her upper abdomen is projected, but her lower abdomen not so much. So I want you to hold this ball here, Kathy. And I want you to project your lower abdomen up towards the ceiling. Very good. And I want her just to do that without the breathing. We're going to do this involved with no breathing at all. We're just going to do this simply through the control of our abdomen. So as you guys see me here, I'm pushing my abdomen out, bring it in. Pushing it out, bring it in. I can also do it through a control of breathing. But we're not working on that quite yet. I want you guys to learn how to control your diaphragm, your breathing muscles, without necessarily having to actually breathe. You can do that involuntarily without having to do any form of breathing. So she's doing that right now. You see she's able to push the ball up, but still her upper abdomen, there we go. Her upper abdomen was a part that was coming up before. Now we're going to just emphasize more of the lower abdomen to help bring her abdominals up. So we're starting to create some separation between the visceral tissue, which is her intestinal fascia, and her rectus abdominis, which is the muscular fascia over the top that actually mobilizes your tissues and mobilizes your body. So right now we're trying to create this separation here. Now what I want her to do, after she's learned that feedback system to get her entire abdomen to expand, I want her to breathe into the entire abdomen here. So I want you to slowly breathe into your abdomen there, Kathy. Breathing in. You're noticing right now her chest is expanding though because she still has somewhat of a restriction on the abdominal wall here. So I want you guys just to think about breathing into your abdomen. Stop there until you feel a stretch. Don't breathe everything you can in. You just breathe in what your body will allow, what your abdomen will allow until you feel that stretch on the abdomen. So she breathes in everything she can until she feels a stretch. That's as much as her body will allow. As soon as you feel the rib cage beginning to expand and do this kind of stuff, that's when we're going to have that problem present in the body. So we don't want to breathe into the chest quite yet. We want to lengthen the abdominals. And the main reason we're trying to lengthen the abdominals is mainly because these tissues are the ones that begin to draw you into that kyphosis and begin to restrict your breathing. If we can get that length here by stretching the tissues out through this form of breathing, now we're going to get a better projection of thoracic extension in the way that I'm doing it right now. Okay? All right, Kathy, let's go ahead and stand up. So we just covered that abdominal breathing to lengthen the abdominals. We did the abdominal stretch to lengthen the abdominals, even the quadriceps, just to lengthen that entire anterior chain of fascia that's going to be restrictive on you getting that better thoracic extension. Now I'm going to have Kathy doing is focusing on back on the standing neutral position. So I want you to stand right here, Kathy, and face that direction. And what I want Kathy to do is now go into the standing neutral. She's already got her joints stacking to where we need it. And all we're going to emphasize here, while she does, she's going to brace her abdomen. And this is going to be very small, guys, very subtle. Instead of breathing through the abdomen now, after we've done that, we're going to then retract the abdomen as far as we can, and we're going to breathe in as much as we can into the rib cage. So I want you to exhale first, Kathy. Then we're going to inhale. Hold your breath. and I want you to exhale 1/10 of your breath out. Let's go ahead and give them an anterior view over here. So all she's going to do is operate at the last 1/10 of her breath. As she begins to lock in that last 1/10 of her breath, you should be able to feel, or as you do begin to do it, you should be able to feel like a tension happening in the thoracic spine. These are your intercostal muscles becoming eccentrically potentiated. These are your mid-trapezius muscles becoming eccentrically potentiated. Your rhomboids muscles becoming eccentrically potentiated. And what I mean by the eccentric potentiation, it just means they're being stretched. So if I do a bicep curl, this is a concentric potentiation. This is the eccentric potentiation. I'm just creating a lengthened tension in the entire back side of a rib cage and the front side of a rib cage. By having a big rib cage, a broad rib cage, all you're doing is you're lengthening muscles so they can load and then contract. Your intercostals actually run parallel to your obliques, your internal and external obliques, and those are actually assisting muscles to your transverse rotation. So when you're sprinting, those intercostal muscles are going to come in very important, not just in the sense of auxiliary breathing, but in a biomechanical sense where they're going to propel you into motion. So right now what we're doing is we're stretching those tissues out as much as we can, and we're creating more muscle activation of the thoracic spine in a fashion that's going to create this eccentric potentiation and really help lock in that thoracic cavity substantially. It's a very simple thing that we're going to do here. You're just locking back into that neutral standing position in the way that you were before, and all you're going to emphasize here is a breath all the way in, everything you can breathe in without letting the abdomen come out. So the belly does not come out because that's going to be its inclination. So if you breathe everything you can in, the belly may come out. That means you're breathing too much. Just breathe everything you can in to the point where your abdomen does not come out, and let your rib cage project outward as far as it can. The last 1/10 of your breath. So you're just going here. You project the rib cage out as much as you can. You exhale 1/10. And just keep going back and forth between that till you feel more and more pressure going to your T-spine. So go ahead and keep hitting a few of those, Kathy. So she's breathing everything she can in, and you can choose to breathe in through your nose or through your mouth. As long as you're feeling that pressure on that T-spine and you feel that kind of that pressure going to your rib cage in general, then you're going to be good. Very good. Just locking in that TBA, no anterior shifts. We already covered the standing neutral position. We're just going to start applying the thoracic extension. This is a small millimetric thing, very small, but it carries huge implications when we begin to look at structural integrity and muscle integration overall. If you do not get these small expansions of that rib cage, it's going to hinder your mechanics substantially when you start moving into a dynamic setting. So again, this is just a very simple tool that you can use. The abdominals retract as much as they can, and then the ribs slowly begin to expand with that abdominal retraction. And it's just that last 1/10, the last 10% of your breath. Do not breathe all the way out. Once you do that, then you just breathe normal. Hold that in and just start breathing what's normal to you, and just think about holding the rib cage open. Exhalation should happen on its own. As soon as I come forward and I take a step, my rib cage on this side is going to collapse, and that's going to crush this rib cage, meaning that I'm going to let out all the air on this side of my rib cage. As I rotate this way, now this side of my rib cage is going to open, and now this side of the rib cage is going to collapse, and that's going to create my exhale. So breathing is kind of more of a unilateral function anyway. Your exhalation while you're moving happens on its own. You should be more concerned about the inhalation, the expansion of your rib cage, because that expansion of the rib cage is what enables you to recoil and come back. If you don't get that expansion of the rib cage, then guess what you're going to get? A hyperextension of the lumbar that's going to try and push the rib cage up to get the air in. We don't need that, because now if you get the hyperextension of the lumbar, then we're going to get lateral displacements of the pelvis going back and forth. That's going to travel up the kinetic chain. That's eventually going to crush the rib cage, and now you're not going to get as much of a volume of oxygen from this. By me just teaching people to do these little things, just with what I've taught you guys in these first 6 weeks, I've gotten people to drop substantial amounts of time off of their running. I've gotten people to breathe much more effectively while they're doing their running. I've seen VO2 maxes increase just by getting the ribs to expand a little bit further. So it's not enough to just improve your physiology of being able to ingest more oxygen by just breathing more. It's, can you create more volume because you're able to take in more oxygen on every breath that you're doing? Remember, the oxygen consumption that you have will determine what kind of pH you're going to have, whether that's an acidic pH or that's going to be a more alkalinic pH. Bacteria does not thrive in alkalinic environments, so you can change your pH just by incorporating good deep breathing. Most of you are operating on the last 2/3 of your breath. That last 1/3 of your breath is a non-existent breath because you never learned the pressure inside your body to really create that volume where you send yourself here and you breathe. Let's say I'll do an exhale. Most of you are not going to be able to do something. To create this huge, huge volume of breath because these restrictions are present in you. You want to create that expansion, this broadening of that rib cage. This is a healthy physiology. These are also healthy biomechanics. There's no separation between this. Your breathing is absolutely essential. You need to be able to emphasize this. In terms of your functional breathing, how you apply this, keep the abdominals in, Kathy. Just think about breathing in and just letting the air out. And let gravity do its work here. Gravity is doing the work of your exhalation. You have to fight to get your exhalation. Your inhalation is going to come under your own volition through muscle activity. That's your serratus posterior, superior that's doing a lot of that work. That's your diaphragm doing a lot of that work. That's your TVA stabilizing to do a lot of that work. Your real work comes on your inhalation, not your exhalation. So your exhalations don't need a lot of work. So those of you who do like martial arts and you do this, that kind of stuff is not really going to be of use to you because it's not training. Gravity should be doing most of that for you. When I practice throwing punches and I'm boxing, I don't really focus too much on those exhalations that often. I do focus on the exhalations, but they're not that strong. I'm more concerned on the inhale. If you focus on that, it's going to change your mechanics dramatically. So let's focus on that right here, Kathy. Very good. So you see the broadening of the rib cage. This is creating that eccentric potentiation of the pec major. And this right here is somewhat more of a functional breath. All right, so this is week 6. Practice this as much as you can. Like I said, there will be a guideline, a guidebook that will help you in terms of the sets, the repetitions that you need to do. Follow that, and you will be good to go. And I will see you guys in week 7. Take care.